Okay, so we're going to go on with meeting physiologic needs, pediatric nutrition, which we did not get to the other day. What is included in the pediatric nutritional assessment? All right, the feeding pattern, appetite, interest in eating, type of diet and the foods eating, the formula in infants, what type of formula are they on? Is it high calorie formula, regular formula? Obviously the height and weight, head circumference in newborns, infants, and toddlers, which we've talked about yesterday as well. Height and weight are helpful indicators of appropriate growth and development and should be measured each time the child has a routine physical exam, as well as if they're going in for an illness that may require antibiotic, they're going to need a weight for sure. And then you're going to measure those and plot them on the graph, on the chart. So the picture I was trying to come up with yesterday is on page 357 and 358. There are specific growth charts for boys and girls. It's not just one growth chart for both. Being sure you're measuring head circumference, which again is routinely measured in children up to the age of 2 or 3, or in any child with neurological concerns. We've already talked about how we're going to do this. This measurement's also plotted on the growth chart, so we showed this picture yesterday as well. Recording intake. So intake are any oral fluids, IV fluids, tube feedings, any foods that become liquid at room temperature, so Jell-O, popsicles, things like that. And then we're measuring output, so urine, vomitus, diarrhea, gastric secretions from suctioning, and any other liquid drainage. So in the infant and toddler wearing diapers, the wet diaper is sometimes weighed, and the weight of the dry diaper is subtracted so they can tell how much intake, how much they're really taking in, because we can't really get it measured like we can from a catheter. All right, newborn is considered birth to 28 days. Newborns can digest the fat and proteins and carbohydrates in breast milk or formulas. They may spit up small quantities of milk. Be sure to realize that there is a difference between spitting up and vomiting. Okay, so vomiting is often very large amounts. Sometimes it's projectile, like across the room. And it's usually pretty persistent. Spitting up is just, I got air in my belly, I didn't get burped very well, so I'm kind of just drooling out some more of my feedings, and that's pretty typical. Newborn feeding patterns are currently recommended on demand, and it's normal, like we talked about yesterday, for infants to lose 5 to 10% of their birth weight, but their weight should be back up to their birth weight by 2 weeks of age. Infant 28 days to 1 year. During the first year of life, the infant's rapid growth creates a need for nutrients greater than any other time in their life, okay? Very rapid growth in this stage. So 1 month to 4 to 6 months, we're doing breast milk or formula. Some formula are fortified with iron. And some breastfeeders are taking iron supplements. It's a pediatrician preference, and they'll let you know. 4 to 6 months, we do iron fortified infant cereal that's added to the diet, and sometimes diluted juices. And then around 7 to 8 months, and sometimes it's actually a little bit before that, we'll introduce baby foods, so fruits, veggies, and meats, and you'll introduce one food at a time. Say we introduce peas first, we're going to do peas for 5 days, and then maybe we'll introduce sweet potatoes. We'll do those for 5 days, and then we'll do pears for 5 days, and we're waiting 4 to 5 days between each new introduction of food to make sure that the child doesn't have any kind of reaction. Right, 9 to 10 months, we're going to eat finger foods that are soft, mashed, and or bite-sized. In 11 months to a year, we're getting into table foods and breads and waters, and we don't really introduce water before this time frame because we don't want it to take the place of the formula or breast milk that has the nutrients and calories that they need. So during the second half of the first year, the infant's milk consumption alone is not enough to meet their high caloric, protein, mineral, and vitamin needs and demands of the body. Okay? Okay. Where are we here? Toddlers, 1 to 3. This is on page 377 in your Leafer book, and I don't know if I mentioned, but the infant stage is on 375 to 377 in your Leafer book, so be sure you review those as well. Page 377 in Leafer tells you about toddlers. So toddlers, eating problems commonly appear at this age. The child's growth rate has slowed, and they may want or need less food than before. And the child also has a very strong drive for independence. So it's very much a battle of the wills over what they will and will not eat. And that's okay, but you have to win. The child's appetite varies according to the foods that are offered, and it's common for the child to desire one kind of food for a long time, and that's okay. If it is toast and jelly every meal of the, breakfast, lunch, and dinner, they get some toast and jelly every single day, that's fine. All right, parents and caregivers should plan meals with an understanding of how the toddler is developing in his or her feeding skills, so you want to provide some finger foods that they can pick up and eat. As well as starting to teach them to use forks and spoons, okay? This family teaching tips on Timby, just disregard that because I don't know exactly what page it's on. All right, preschool age, this is on page 378 in your book, so this is 3 to 6 years of age. These children do not need large quantities of food because it is not a rapid time of growth and development for them. Protein needs do continue to remain high to provide muscle growth. And the appetite is very erratic, so the preschooler may devour everything in one sitting and absolutely nothing at the next sitting, and this is normal. All right, the preschooler generally accepts frequent small meals, so it cannot be 3 meals a day. It's going to be more like 6 small meals with snacks. And among their favorites are any soft foods, grains, dairy products, raw vegetables, and of course sweets. Preschoolers need guidance in choosing foods. They are strongly influenced by family members. So if you hate asparagus, that doesn't mean your child will hate asparagus. If you don't like diced carrots, that doesn't mean your child will not like it. You need to offer it and see how they will tolerate it. Don't dissuade them from trying new things and eating new foods. Also be sure not to bribe or reward children with food, okay? This can cause issues down the road. And I say that and it sounds very simplistic, but it's easy to do, okay? The preschooler needs 2 to 3 glasses of milk a day and several small portions from each of the other food groups. So make sure that they're not getting too much milk and not enough from the other food groups, or too much from food and not enough milk. All right, now we're moving into the school age child. This is on page 368 in your Leafer book. This is age 6 to 10. This child generally becomes more active and requires more food, so be sure to choose appropriate amounts from all the food groups. This is also when the child's sense of taste matures. So they may have liked diced carrots for all these years and all of a sudden they hate diced carrots. That's okay, okay? I don't believe in forcing kids to eat what they hate, but I do believe they should try a bite of everything at every time you fix it. They're going to try up at least one bite of it, and eventually they may like it again, okay? They often prefer very simple, plain foods, so hamburgers, cheeseburgers, peanut butter and jelly, whatever. Something simplistic. Disease, strong emotions, and forcing the child to eat may result in a loss of appetite. And this is where obesity can begin. So encourage a lot of physical activity and limit the dietary intake of fat to 35% of the total calories, okay? You want to avoid popular fad diets with children. You should not ever put a child on a diet unless it is medically recommended, and then the pediatrician will let you know specifically what to do. Adolescents are 11 to 18 years, and this is on page 379 in your Leafer book. So adolescents, the national requirements are increased during this period of rapid growth with participation in physical activities. So nutritional needs are related to growth and sexual maturity rather than age. Boys have more caloric needs than girls, which I can attest to. And appetite increases. Most teens eat very frequently. So I feel like my kids don't ever stop eating, and my grocery bill is sky high right now. And I hate going to the grocery because I hate getting that bill. And I shop at Sam's a lot so I can buy in bulk, and I feel like I'm going to Sam's every week. Teens will often skip meals, especially breakfast is the primary meal that they're going to skip. Teens tend to snack on foods with empty calories and fast foods, resulting in nutritional deficiencies. They have this newfound freedom where they are now able to drive themselves to the store. They can drive themselves to the convenience store and pick up junk. They can drive themselves to the fast food place, or they hang out in fast food restaurants with their friends, or Dairy Queen or McDonald's or whatever. So it's very important for families to establish good eating habits early in childhood, okay? Nutrients that are usually deficient at this age group in the adolescent are going to be calcium, iron, vitamin A, D, B6, and folic acid. All right, and this is also where teens will some experience with some fad diets, so you need to be very cautious and conscientious of these things. So be a good example for the teens and adolescents. Stock the refrigerator with healthy, ready-to-eat foods. They are very much into immediate gratification. They're not going to wait for you to fix something for them. And they're certainly not going to fix it themselves when they can just grab junk. So having on hand easy things like celery and dip, carrots and dip, celery and peanut butter, strawberries, grapes, whatever that they can quickly grab and go. That's what they're going to eat. All right, then we've got some malnutrition issues. So protein malnutrition, we've got kwashiorkor, which is a severe deficiency of protein with adequate caloric intake. So they take in a good amount of calories, but not enough protein in those calories. Accounts for most of the malnutrition in the world's children. And then we have marasmus, which is a deficiency in calories and proteins. And so this is common in children in third world countries. All right, we've got vitamin deficiency diseases that you need to be aware of. So rickets, scurvy, beriberi, and pellagra. So rickets is lack of vitamin D, scurvy is a lack of vitamin C, beriberi is a lack of thiamine, and pellagra is insufficiency of niacin. So be sure that you read up on those. Just get a little more information, or at least read through the PowerPoint here. We've also got mineral insufficiency. So iron deficiency anemia is very common, especially in children older than 4 to 6 months of age whose diets lack iron-rich foods. It's often found in poor children younger than 6 in the United States. We've also got hypocalcemia, which is obviously from insufficient calcium, and it can cause neurologic damage and mental retardation, and children with milk allergies are particularly at risk for hypocalcemia. All right, speaking of milk allergies, let's move on to allergies. So symptoms vary from one child to another. They may appear very quickly, or later on they may have a delayed reaction. We may have hives, pruritus, stomach pains, respiratory symptoms. You need to be alert for all of those. Milk is the most common food allergy in young children, hence the reason for the mineral insufficiency of hypocalcemia. We have all these other listed. Peanuts is one of the most severe allergies. Children and adults have severe anaphylactic reactions to peanuts now, so you have to be very, very meticulous with those. Oranges, strawberries, chocolate, lactose, these are all very common food allergy foods that cause allergens for children. We already talked about this, introducing foods 4 to 5 days apart. Some food allergies disappear as the child's GI tract matures. So just because they were allergic to it, I was allergic to milk as a child, but I can tolerate milk now. It's not my favorite, and it does sometimes upset my stomach if I take very much, but I can tolerate it now. Eating disorders such as obesity, anorexia nervosa, and bulimia are the most common health problems. So in these children, food represents nurturing and security. Okay. Misuse of food can create health problems, very long-term health and psychological issues. So obesity often begins in childhood. We talked a lot about obesity yesterday. We talked about adolescent eating habits. Snacking and watching TV contributes to excess calories. So just be sure that you're educating your patients on these different factors that go along with obesity. Okay, we've got genetic factors that play into it, social, cultural, metabolic, and psychological factors that feed into these eating disorders. All right, much of a teenager's life revolves around food. Very true, I can attest. So they have after-school snacks. I feel like my kids do not stop eating from the time they walk in the door from school until dinner. Of course, they don't want dinner because they've eaten all afternoon. Also, these ice cream shops, pizza parlors, this is where they hang out and talk to each other. Fast food restaurants, okay? We can also have on the other end anorexia nervosa as well as bulimia nervosa. But anorexia nervosa is basically a self-inflicted starvation. They choose not to eat at all. It has increased a bit with the current estimation to be 1% of adolescent girls experiencing anorexia nervosa. And it is usually caused by a preoccupation of being perfect or having a thin figure. People can and do die often from anorexia nervosa. It does not matter how skinny they are, they feel like they're fat. All right, then we have bulimia nervosa, which is characterized by binge eating followed by purging. So again, the white female of late adolescent age, the person is usually alone when this happens because they need privacy. The adolescent will eat large quantities of food for 1 to 2 hours, then start feeling guilty, induce vomiting, laxative, diuretics, or excessive exercise. Okay. I watched a program, one of those TLC things brought me to the ER about a young girl whose parents had no idea what was wrong with her, but she was having trouble breathing, and they took her in and they tried to get out what was ever in her throat. I mean, they could tell she had some kind of obstruction. They tried to get it out. They were unable to do so, so they ended up giving her some sedatives to try to get everything relaxed a little bit, and going in with like an endoscope and little pinchers basically, and grasping whatever was caught in her throat. When they finally pulled it out, it was a fork. So she had bulimia nervosa, and she had been gagging herself with the back of a fork, and she had done it for so long that her gag reflex was no longer sensitive to being gagged, and she kept having to stick the fork further and further back. Well, it got stuck, and her parents had no idea that she even had an eating disorder. So you just need to be aware. It can happen with anyone. So be sure that you're aware. Okay, any of this content can be on the test, as you know. Let me know if you have any questions or concerns.